The behaviorists are on board with it, and they're helping with it. Um, and we can talk about, as we move forward, some of the things that we want to do to take this to the next level, so we can get to that.
So you talked. I've seen a little bit in the reception area. We've got towels. What you put fell away for the cats. I think the treats are right there by the scale out there in the
Yes.
reception area, and I know that happens in the exam room. What do you do to keep that calm level into the treatment area, which sometimes can be the scariest thing for some cats and dogs who've been there before?
Yeah. One of the things we're starting to do is on a lot of pets, we find that we can do the procedures in the exam room. And I know that's scary for a lot of veterinary clinics. Scary for a lot of veterinary clinics. Um, and for us, it was a big change, and we still have some technicians that are uncomfortable with it. But more and more of our technicians are starting to do that. So, nails. We're doing a lot more nails in the room. Okay, that way the client can be a part of it, and they can help us with the massage techniques that we do when we're doing nails. We love to massage a dog on the forehead, rub those ears, and it'll help. It doesn't always take care of all of it, but at least on some dogs, they love to have those ears rubbed, and it has a calming effect, so the owners can be a part of that. And so we'll try to do what we can in the exam room as much as we can. Um, for blood draws, for heartworms, especially on these big dogs, we're using the back leg, and we're using that lateral saphenous vein because, again, we can have the owner or the doctor or the veterinary assistant up front working on the dog's head, and the technician can be back there drawing in blood. And the big dogs, you can actually get three cc's of blood out of there and get all your blood that you need for the... So we are trying to do more of the procedures in the exam room with the clients. Now, you have some pets that it's just not going to work, and honestly, you have some clients that would rather you not. They don't like needles, and they want you to go in back. So we will try to get the pet in back, and there are some pets that we get in back that they just don't want to hold still for the owners. It's not that they're nervous, it's just that, boy, they know they can get away with things with mom and dad. And so when they get in back, they're fine, and we can do some things we need to do. But for the pets that are still anxious, we do the thunder shirts. We're trying treats. Some of them are too nervous to do that. We do massage techniques. And typically, well, it takes a little bit of time. It's often a three-person job to do nails on some of these guys, but we can do it without sedation, and we can do it without having to knock the dog out completely. Not all of them, but a lot of them we find. But again, massage techniques. I mean, one of our doctors is an acupuncturist, but apparently there's some acupuncture sites in front of the ears that have a calming effect. But if you start massaging these, a lot of dogs, it'll help. You start massaging the ears. We're letting them sniff peanut butter while we're doing things. And so those are the things we try to do in back. And then honestly, you've got some pets that are beyond that, and honestly, we've got to look at it. We'll just tell owners, listen, we're not going to be able to, we got blood today, we cannot do the nails. It's going to take them to another level, and we don't want to do that to your pet. So we can try it again another time and just do nails. Two, if that's still not working, then we can start to look at some theanine type of products, clomicalm. Sometimes we need to get them on some other drugs, and then sometimes we have to move to sedation. We find that the majority of owners are not inconvenienced by that. They appreciate it. They appreciate the fact that we're trying to keep your pet as calm as we can so that when they come in here, it's not a horrible experience for them. And we find the majority of owners appreciate it and will come back. You get the occasional owner who it's just inconvenient, and that's just not, but you know what? They're the exception.
So after you've explained everything that we don't want to ramp this dog or cat up any more than they already are, so we don't want to do this next procedure, which we know is going to bother them. Do some people still demand, you have to do it now because I can't come back?
We get the occasional person.
Okay, but it really is very much the rare case as opposed to the average one.
It really is. It really is. And we're fortunate, and I think most veterinary clinics are seeing more and more clients where the pets are really members of the family, and they appreciate that. You still get some where it's just a dog, and but for the majority of folks that I think we're seeing today. They're part of the family.
How much time, so on a busy day, how much time does this take? The receptionist thinking about thunder shirts and feel away in the lobby, the technicians giving cats time to go out and roam around. It sounds like it takes so much time for these appointments, does it?
It doesn't. It becomes part of a routine, and the more you do it, the better you get at it and the quicker you get at it. Certainly when you first start, it's just something new, but it's new like that with anything you do in practice. And aside from fear-free, it's any new procedure you introduce. It's going to take time initially, but once it becomes part of the routine, you become very good at it, and you recognize it. And in fact, with some of these anxious pets, it ends up saving you time because you're not sitting there really trying to fight the pet, and you're trying to get a muzzle on it and do all these things. And as you start to learn some of these pets and you find the things that are really working, and we make notes of it, that when the pet was in and we're doing the nails, this technique worked really well. And that helps the next time they come in. We already know that, we tried these 2 other things. It didn't work so well on this pet, but this pet loves peanut butter. And we put that in the chart. And we do those types of things. So it will start to save you time with some of these more anxious pets.
Do you think practices are losing money because they're not doing low stress handling and not doing more fear-free stuff?
I don't know that they're necessarily losing money. I don't think but I think the opportunity to grow your practice at a faster rate is there because word does get around, and we all agree that, our biggest source of new clients is word of mouth. And as your clients start talking about this to their neighbors, and word starts to get out, and we have clients that tell us, we came to you because so-and-so said, you were really able to help their dog or their cat. That's what I think veterinarians are missing out on by not embracing low-stress handling techniques.
It might be too much of a separation, but when you think back to what the experience was as a doctor and technicians and team members at a practice where everyone was dealing with agitated, fearful, sometimes aggressive animals because they're so amped up, was that a worse experience for the people who work there than it is working in a place that focuses more on low-stress handling?
Yeah, people that are attracted to this profession love pets. I mean, that's the reason they do that. That's the reward, is being able to work with pets and help. And nobody likes bullying, so to speak, a pet to get something done. You don't feel good about that. And but boy, I can remember when I first started in practice, 30 some odd years ago, though, that's just what you did. And maybe that was coming out of the cattle industry and stuff, where that's just how you handled it, And we just translated that to pets, that if they're giving us trouble, man, we're just going to manhandle them. But it's not rewarding. With the way we feel about pets today and being part of the family, and we all agree as staff members, it's not the way I'd want my pet treated. That's my baby. That's my little girl. It's my little boy. And we want to do whatever we can to make them feel as low stressed as we can. So, yeah.
How much of incorporating fear-free and low-stress handling and low-stress visits is about just doing the stuff, and how much is it about explaining to the clients what's being done and what's happening?
Oh, I think it's probably pretty much equal. This is kind of new to veterinary medicine. I mean, we're ramping up, and we're doing more and more over the last couple of years now. But to a lot of our clients, this is something new, especially if they're coming to us for the first time and they've been going to other veterinarians in the past, and they have no idea when we pull out the peanut butter, or we pull out the cheese, and they're wondering, what the heck are you doing, And so yes, we have to explain why we do these things, okay? We don't necessarily call it fear-free to our clients. We're just telling them we're trying to reduce anxiety levels and stress levels and make it a more pleasant visit for your pet, and ultimately for you if we do that. And they start to see the logic in that, and they go, well, yeah, absolutely. So yes, you're probably going to spend equal amount of times explaining it to clients and what you're doing. Now, after they've seen it 1 or 2 times, it starts to become an expectation. You no longer have to expect it. And it's like I said, if you don't pull out the cheese, that's when they're starting to question, why aren't you doing that? So, and we love hearing that. So,
Is there any of the fear-free tips that you've seen through the years, either on video, through CE, or in magazines, or heard from other practitioners, that didn't work as well as you thought they would?
you know, I think you will find any of the techniques may not work as well on different pets. There's not, they're individuals. And so thunder shirts work well on maybe 60% of the pets. And I tell clients if you have a pet that likes to snuggle, be it a big dog, small dog, cat, if they like to snuggle, odds are that thunder shirt's going to work because they like that feeling of being wrapped and being close. If you've got a pet, and we see it in dogs and cats, that just, I'll come to you for a pet now and then, but if you want me to sit on your lap, it ain't going to happen. Thunder shirts probably aren't going to work. Okay, so we got to try some other things. We have some pets that are not food motivated. We have some pets that don't like toys. They don't like tennis balls. So I think there's a lot of suggestions in terms of fear-free practices and things like that you can try. I think they're all worth trying. It just depends on the pet. You have to kind of personalize it, if you will, to the pet. And so it's good to have a black bag full of different techniques because you're going to need them.
Do you think veterinarians in general, across the generations, are more comfortable with a routine they can follow for every cat and every dog? Or do you think they like this idea? Because I've heard this from multiple people here, really talking about a toolbox of options,
Yeah.
And trying to employ different ones on different animals. Is it easier just to treat them all the same, or is it more rewarding, more exciting to be able to treat each animal individually in the moment?
For us, we certainly find it more rewarding. I mean, you can try to treat every pet the same. Medically, that doesn't work. It just doesn't. And you have to customize or personalize it based on the clinical signs are showing, based on history and things like that. So as veterinarians, from a medicine perspective, while we have a vomiting dog, we have a certain procedure we follow and so forth, but we also realize that it's not going to work for every pet. And the same is true for these fear-free handling techniques. So why look at it any differently? I mean, it's something that you've got to personalize, customize, just like you do any other thing we're doing in practice. So routine is always easier. It's easier. You know it, and change is always difficult. But the real rewards come when you have to figure things out. So, absolutely.
Okay, Portia, you've been sitting patiently back there racking up questions.
You can hear the pen on